Yeah. Hello everyone. So we will start with the MCQs. So the first one is which of the following statements is true regarding Curly A lines? And the options are radiate from hilum of the lungs, runs perpendicular to the pleural surface and extend out of it, has spider web appearance, or short lines which do not reach the pleura. Okay, I'll repeat the question once again. The question here is which of the following statements are true regarding the Curly A lines? Curly A lines are basically in the lung, if you know. So what are the following statements are true regarding the Curly A lines? And the options are radiate from hilum of the lungs. Option B is runs perpendicular to the pleural surface and extend out of it. Option C is has spider web appearance, or option D is short lines which do not reach the pleura. So if anyone wants to answer this, what is true regarding the Curly A lines? So I think you know what is Curly A lines. It's in Curly lines are in the lungs. It's in the interlobular. It's in the interlobular septa and in the interlobular septa in the pulmonary interstitium. So if you know the answer. There are basically 4 types of Curly, that is A, B, C and D Curly lines. 4 lines are there. And okay, I will get the answer here. The answer here is A, that is it radiates from the hilum of the lung. So so basically what happens if there is a lymphatic engorgement or if there is an edema of the lung, so you will find the Curly lines. So Curly lines are basically A, B, C and D. So A line is from the answer is that is radiate from the hilum of the lung, and the B option was that is runs perpendicular to the pleural surface and extend out of it. But it's a Curly B line, not Curly A line. And then we has spider web appearance. Spider web is in the Curly C line, and so the right answer is A, that is Curly lines radiate from the hilum of the lung. Next question we have fast vibration sense is mediated by. I think it's audible. See, fast vibration sense is mediated by. The options are Merkel's disc, masonal corpuscles, Pacinian corpuscles, or Ruffini end organ. Because these are parts of skin only. To tell which is that fast vibration sense is mediated by Merkel's disc, masonal corpuscles, or Pacinian corpuscles, or Ruffini end organ. Anyone wants to try this? Okay, I will tell the other one. See, Merkel's disc is basically used for what? Merkel's disc is basically for where I was. Merkel's disc is for touch. So the answer right here is C, that is the Pacinian corpuscles is used for this fast vibration sense, and it's a part of the skin. So others like we have masonal corpuscle, it's for tap and flutter, and Ruffini ending is for stretch and fluttering vibration. So the answer here is C, that is the Pacinian corpuscle is the right answer, which has fast vibration sense. Then next question we have which of the following components are included under the modified Kappu-Swamy scale for socio-economic status? And it's a multiple choice question. So the options are income of the family, monetary value of material possessions, education of head of the family, occupation of head of the family, or number of family member. So I'll repeat the question. Which of the following components are included under the modified Kappu-Swamy scale for socio-economic status? It's a multiple choice question. So its options are income of the family, monetary value of material possessions, education of the head of the family, or occupation of the head of the family, and number of family members. So if you can tell the answer. Anyone? It's a multiple choice. And the Kappu-Swamy. Okay, the answer here is anyone? Okay. The answer is 1, 3 and 4. What is 1, 3 and 4? 1 is the income of the family. Then 3 is the education of the head of the family, and 4 is the occupation of the head of the family. And others are not included in the Kappu-Swamy for socio-economic status. So it's a PSM question you have to remember. No one remembers this, but you can. So it's the income of the family, education of the head of the family, and occupation of the head of the family is included under the Kappu-Swamy scale for socio-economic status. Next we have which of the following ribs is atypical and doesn't articulate with the vertebra at 3 sides? And the options are first rib, second rib, sixth and eighth rib. I will repeat, which of the following ribs is atypical and doesn't articulate with the vertebra at the 3 sides? So it's first rib, second rib, sixth rib, or eighth rib. Anyone can guess at least? I think no one knows the answer today. Okay, the answer here is that is the first is the right answer. That is first rib is atypical and doesn't articulate with the vertebra at the three sides. So yeah, this you all know. It's a typical rib from 3 to 9, and atypical it's 1 to 10, 11 and 12 are atypical ribs. So it's anatomy question. So yeah, I'll repeat. It's atypical are first, second, 10, 11 and 12 are atypical, whereas 3 to 9 are typical. And typical, what is typical? That is, it's a curve and has a shaft with anterior and posterior ends. Okay. Next question we have, according to the Indian Evidence Act, IEA section 45 gives information regarding what? Evidence, expert witness, hostile witness, or dying declaration. So I'll repeat, it's a forensic. According to the Indian Evidence Act, IEA section 45 gives information regarding what? Evidence, expert witness, hostile witness, or dying declaration. Yeah. Okay, yeah, so I will tell the answer. Its answer is B, that is expert witness. So basically, according to that IEA, what I told, Indian Evidence Act, section 45 gives information about the expert witness. So you have to remember this. See, suppose the options are evidence. Evidence is IEA section 3. Dying declaration is 32. Expert is 45. And 45 was the question only. And hostile witness will be 154. So you have to remember this question and the answer. So your next question we have, the pap smear of a healthy 30-year-old lady is given below. Identify the microorganism. So I'll just tell what is during the pathology, if you can just tell from that. So yeah, it shows borderline bacillus. So yeah, it's a hint. Borderline bacillus, also known as lactobacillus. So yeah, the question is, the pap smear of a healthy 30-year-old lady is given below. Identify the microorganism seen. And it's, I already told the answer, I think. Yeah, it's options were borderline bacillus, Gardnerella vaginalis, Trichomonas vaginalis, or first bacillus. Basically, rod-shaped bacillus was seen. That's why it's the answer here is A. That is the borderline bacillus is the right answer. So I only told the answer. Yeah, sorry. Okay, next we have, what effect does desmopressin have when given to patient with coagulation disorders? And the options are increases factor 8, increases factor 9, it's 11, or it's factor 7. Sorry. So I'll repeat. It's what effect does desmopressin have when given to patient with coagulation disorders? It increases factor 8, 9, 11, or 7. Would you like to answer this? Okay, the answer here is, if no one wants, it's A only. It's that is increases factor 8. So yeah, there is a transient rise in increasing factor 8 and 1 milligram factor, and hence it is given mild to moderate hemophilia A. So yeah, the answer is increases factor 8. So this also today all the questions are factual only. So yeah, it increases factor 8. Yeah, and factor 8 and 1 milligram factor both. Next we have, here is a picture also. Okay, I'll tell this. It's a man presented with bleeding per rectum, and which he noticed after passing stools for the past 2 weeks. And on straining, a reddish mass as shown in the image was given protruding out of the anal canal. It did not reduce spontaneously and had to be manually reduced. What is the grade of hemorrhoids? Usually the picture of the hemorrhoids, it does not reduce spontaneously and had to be manually reduced. And it's for the past 2 weeks, and bleeding plus rectum is there. So what is the grading? That's what they have told. For 4th, 2nd, 3rd and 1st. So just tell what is the grading when you have a spontaneous, doesn't have a spontaneous reduction and manually you have to reduce. That way just tell me the degree of the hemorrhoids. Grade 3, yeah, grade 3 is the right answer. I will tell all the grades one by one. See, the first is bleeding with no prolapse. Second is prolapse will be there but no with spontaneous reduction, and third is that one prolapse requiring manual reduction, and fourth is prolapse is there but cannot be reduced. So yeah, I think you got it. It's first degree is no prolapse, second is spontaneous reduction, third is manual reduction, and fourth is that is cannot be reduced only. Next we have, which of the following is the most common type of anorectal abscess? And the options are submucous, pelvirectal, perianal, and ischiorectal. So this I think if you know you can tell. Which of the following is the most common type of anorectal abscess? And the options are submucous, pelvirectal, perianal, and ischiorectal. If you can guess at least which is the most common type of anal-rectal abscess. So anal-rectal abscess, as you know, it's basically pus forming. Abscess is also, abscess only means pus. So yeah, if you can tell the answer, it's a cholesterol. Yeah, it's okay. I'm going to tell the answer here is C. That is the perianal abscess is the most common type of anal-rectal abscess. There are 4 types, as you might be knowing: perianal, ischiorectal, intersphincteric, or supralevator. Ischiorectal, no, ischiorectal is not the common. Perianal is the most common type of anal-rectal abscess. Next, we have in a child, the amoebic liver abscess can be diagnosed by demonstrating which of the following. The options are cyst in the sterile pus, trophozoites in the pus, cyst in the hepatic venous sample, or trophozoites in the feces. I will repeat, it's a child with amoebic liver abscess and can be diagnosed by demonstrating which of the following: cyst in the sterile pus, trophozoites in the pus, cyst in the hepatic venous sample, or trophozoites in the feces. You have to know basically the pathway of the amoeba, that is amoebic liver abscess. So where will you get? Anyone? It's in the feces or in the pus, or it is in the cyst is in the hepatic venous sample, or cyst in the sterile pus. So okay, the answer here is D. No, it's not in feces. See, liver abscess, how will it go to feces? Okay, the answer here is B, that is trophozoites in the pus. So yeah, the answer is trophozoite in the pus, and they have given all flash shape uterus, flash shape ulcers will be there. Yeah, it's amoebasis. We have seen flash shape ulcers, but yeah. Treated with it, if it is invasive, it is treated with, yesterday only I discussed, if it is invasive amoebasis, we have to treat with that with what? We have to treat with nitromethazoles or metronidazole only. And if it's a luminal amoebasis, we treat with paromycin. Yesterday only we discussed that. Paromycin for luminal, for invasive it is metronidazole. So yeah, the answer was trophozoites in the pus. You will find it is not in the feces. And yeah, next question we have: bone marrow biopsy in a patient shows pseudo-Gaucher cells. What is the most viable diagnosis? Yeah. So I repeat, it's a bone marrow biopsy in a patient shows pseudo-Gaucher cells. What is the most viable diagnosis? Primary myelofibrosis, chronic CML, essential thrombocytopenia, or CLL. So it's a bone marrow biopsy. It's basically to remember pseudo-Gaucher cells seen in which condition? Primary myelofibrosis, chronic CLL, CML, or essential thrombocytopenia. Sorry. It's a characteristic feature of what? Okay, I will only tell it's a characteristic feature of CML. In CML, we see as pseudo-Gaucher cells. Basically in microscopy, CLL, no. It's a CML only. Yeah. And these cells are scattered in microphages with abundant wrinkled green blue cytoplasm. Their presence indicates a good prognosis, but it's seen in CML, not CLL. Next we have Arthas reaction is caused by which of the following process? And the options are localized immune complex mediated, systemic immune complex mediated, complement mediated, or antibody mediated. Basically they are telling a hypersensitivity reaction which type it is. I'll repeat, it's a Arthas reaction is caused by which of the following process? In detail they have given this: localized immune complex mediated, systemic immune complex mediated, complement mediated, or antibody mediated. So yeah, if you know what is Arthas reaction, you can tell. We have no type of hypersensitivity reaction, if you know that. Okay, the answer here is A, that is it's a localized immune complex mediated. Okay, types to know, it's from 1 to 4. First one is the immediate type, which have anaphylaxis or allergy, what we know, and type 2 which is autoimmune, that is antibody mediated. Type 3 is SLE or Arthas reaction, what I was telling, it's an immune mediated hypersensitivity, and type 4 is the cell mediated hypersensitivity. We have chronic dermatitis, multiple sclerosis, and TB or diabetes. So you have to remember all type 1 to type 4. And Arthas reaction is basically type 3 hypersensitivity reaction, which is immune complex mediated. It's a localized immune complex mediated. Next we have which of the following patients would you screen for diabetic retinopathy? Usually it's a multiple choice. So which of the following would you screen for diabetic retinopathy? Its question is, the options are: a 10-year-old on treatment for type 1 diabetes for the past 2 years, then a 48-year-old man newly diagnosed with type 2 diabetes, then 25-year-old primary gravida with gestational diabetic mellitus, and 62-year-old with diabetic neuropathy, or a 22-year-old woman with pre-pubertal onset of diabetes. So it's a long question. They have given 5 options and it's a multiple choice question. So you can tell whatever 1 to 4, 1 to 4, all that. So which I think I should repeat or I don't. So I will repeat. Let's say which of the following patients would you screen for diabetic retinopathy? A 10-year-old with treatment of diabetes for past 2 years, 48-year-old newly diagnosed for type 2 diabetes, 25-year-old primary diabetes with gestational diabetes, and 62-year-old with diabetic retinopathy, nephropathy, and 22-year-old with pre-pubertal onset of diabetes. We will leave all that off. It's basically the answer here is C. For which patient do you see diabetic retinopathy? Diabetic retinopathy is basically later stage after sleep. It's a eye manifestation. So basically you will see they are given 2, 4, 5. That is a 48-year-old. That is its old age. That's why 48-year-old and it's a newly diagnosed type 2. Then that is 62-year-old. It's also a old age one. 2, 4, 5. Yeah, 2, 4, 5 is the right answer. And it's a 5 is a 22-year-old woman with pre-pubertal onset of type 1 diabetes. So basically it is done at 3 to 5 years following diagnosis of type 1, whereas patient with type 2 must be seen at the time of diagnosis. You have to remember this. Basically for type 2 you have to see at the time of diagnosis itself. For type 1 it is like 3 to 5 years following diagnosis. So yeah, you have to remember for 3 to 5 years for type 1 and immediately for type 2. Next we have a young man presented with 2 weeks history of auditory hallucination and delusion of grandiosity. His history is significant of severe depression is there with psychotic symptoms. However, he has been euthymic for the past month. According to the DSM-5, what would you be like to diagnosis? It's a schizoaffective disorder, schizophrenia, mood disorder with psychotic symptoms, or schizophreniform disorder. I will repeat, it's a 2-week history of auditory hallucination, delusion of grandiosity, severe depression with psychotic symptoms, and he has been diagnosed. He has been euthymic for the past month. According to DSM-5, what would be likely diagnosis? So schizoaffective, schizophrenia, mood disorder with psychotic, or schizophreniform disorder. So yeah, what time is the answer? Okay, according to the DSM-5 criteria, what all I told, it goes towards the schizoaffective disorder. Because in schizophreniform. No, schizophreniform will have the same symptoms as schizophrenia and functional decline is not required, and duration greater than 1 month to 6 months. No. Okay, the answer what I said is the answer is schizoaffective disorder, and according to DSM-5, it's like an uninterrupted period of illness where there is mood episode concurrent with psychosis. Delusion or hallucination will be present for at least 2 weeks, or absence of a major depressive or maniac episode. Mood symptoms present for the majority of total illness, and it is not due to intake of any substance. It is substance abuse. So basically, others are all differential diagnosis, but you have to remember whatever I told, that is hallucination and all that, it will be schizoaffective disorder. Whereas in schizophrenia, what they have given is it requires a functional decline, it should be there. So there is no decline here, and at least 6 months should be there. Yeah. So yeah, the answer here is schizoaffective disorder. We have to read it once again so that you can differentiate all. So next we have a teenage boy presents to you with recurrent epistaxis and hearing loss. On examination, he has a frog face deformity and a conducting hearing loss. So which of the following is the investigation of choice to diagnose this condition? So the options are NCT scan, MRI scan, CECT, or carotid angiography. So yeah, I will repeat, it's a teenage with recurrent epistaxis and hearing loss. Examination, you have a frog face deformity and conclusive conductive hearing loss. Which of the following is the investigation of choice to diagnose this condition? NCT, MRI, CECT, or carotid angiography? So yeah, if anyone can tell this. Okay, basically diagnosis only you can tell at least. Without your diagnosis here. I will repeat, it's a recurrent epistaxis, hearing loss, frog face deformity, and conductive hearing loss. That is, what is the investigation of choice to diagnose? The same way what is the diagnosis with all this epistaxis and all that hearing loss. Anyone can tell the diagnosis first. Otherwise you won't be able to tell. Okay, well, I will tell it's basically angiofibroma. Yeah, that's a nasopharyngeal angiofibroma is the diagnosis. Yeah, and CECT is the right answer, because in CECT we do for nasopharyngeal angiofibroma, CECT we do. MRI can be done, but it's complementary, and carotid angiography it's not that much. It shows only vascularity, and biopsy is not indicated here because it's contraindicated as it can lead to massive hemorrhage. So yeah, CECT is the right answer. Next we have a 4-year-old child is brought to the casualty in respiratory distress. In order to intubate this child, which is the appropriate size of endocardial tube to be used? Options are 4 mm, 5 cm, 4 cm and 5 mm. So yeah, I will repeat, it's a 4-year-old and he has respiratory distress and you are going for intubation. So what is the size of the endocardial tube you will use? It's 4 mm, 5 cm, 4 cm or 5 mm. Anyone? Okay, yeah, the answer you have to remember, it's an SSA question and you have to remember D. Yeah, D is the right answer. So 5 mm we use for basically for children pediatric age group, and yeah, appropriate is 5 mm. Size of the tube refers to the internal diameter in millimeter, and the formula is 4 plus h by 4. So it's like 4 plus 4 by 4, that is 4 only. That is 5, sorry, 4 plus 1, 5. So you have to remember this formula, 4 plus h by 4. And for full-term infant it's 3.5. Child we know it's the formula is 4 plus h by 4, yeah. And for adult it is 7 to 7.5, and for adult female it is 7 to 7.5. For male it is 7.5 to 9. You have to remember this. And formula is 4 plus h by 4. Next question we have, male is there. Male patient weighs 50 kg and has acute onset severe asthma, for which thiofilling infusion is planned. So the target plasma concentration is 10 mg per dl. So next we have the volume of distribution of thiofilling is 0.6 liter per kg. So what will be the load and dose in this patient for intravenous administration? Again, some formula will be there. It's a biochem, not it's a pharmac, I think. Yeah. So yeah, the male is there, 50 kg is weight, severe asthma is there, thiofilling you are planning, and target plasma is 10 mg per liter. Volume of distribution is 0.6 liter per kg. What will be the load and dose? So it's 200 mg, 250 mg, 300 mg or 350 mg. So if you know the formula only, then only. But what is the formula for load and dose? Okay, tell the formula, you can just with the formula you can do actually. So what is the formula for load and dose? The load and dose formula is target Cp into Vd by F. So yeah. So you have to tell it's a target Cp. What we have here is 10. Yeah, you have given 10 mg per liter and they have given target Cp. So it's 10, and the Vt, that is volume of distribution, they have given is 0.6. So you have 10 into 0.6 by F. And what's F? For intravenous route we know it's 1. Yeah, answer is 3. So yeah, it will be like 0.6 into 10 by 1. Cp, F is biological factor. Yeah, 10 into 30, that is 300. 300 is the right answer. Yeah. Basically it's 10 into 0.6 by 1. Yeah. So basically 300 is the right answer. I was confused. Sorry. So yeah, I have to remember this formula for load and dose also. Next we have which of the following drugs is recently approved for the treatment of colorectal cancer arising through Lynch syndrome. And the options are, it's a recent advance. So it's ipilimumab, nivolumab, pembrolizumab or rituximab. I'll repeat, which of the following has been recently approved for the treatment of colorectal cancer through Lynch syndrome? And the options are ipilimumab, nivolumab, pembrolizumab and rituximab. You can tell about the answer. What is a recently approved drug? So yeah, the answer is that is C, that is the pembrolizumab is the right answer. It's recently approved for colorectal cancer through the Lynch syndrome. And yeah, basically there is an increased risk of colorectal cancer in Lynch syndrome. That's why the drug we have used, it's an immune checkpoint inhibitor, and the answer that is not A, it's C, that is pembrolizumab is the right answer. And basically it's an immune checkpoint inhibitor, so you have to remember it's a recent advance. So pembrolizumab is used for the treatment of colorectal cancer associated with Lynch syndrome. Next we have, what is the main objective of the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana? And the options are improve maternal and child health services, make quality generic medicine affordable to all, enhance quality of life and increases employment for differently abled, promote cleanliness and enhance quality of healthcare facilities in India. This I think anyone can tell. I will repeat what is the main objective of Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. Options are improve maternal and child health. Second is make quality generic medicine affordable to all. Third is enhances quality of life and increases employment for differently abled. And fourth is promote cleanliness and enhance quality of healthcare facilities in India. B. But this anyone can know. It's a Jan Aushadhi. Aushadhi means medicine. So yeah, it's a quality, make quality generic medicine affordable to all. Next we have a 22-year-old man presents with you with high-grade fever is there and purpuric rash as shown in the image. So then CSF sample was taken which shows gram-negative diplococci. So what is the most likely etiology? The options are Neisseria meningitis, Pseudomonas aeruginosa, Streptococcus pneumonia or E. coli. So yeah, if anyone can see basically the rash, it's a purpuric rash. Image is okay, I'll repeat. 22-year-old, high-grade fever, purpuric rash, and CSF you see a gram-negative diplococci. So what is the most likely etiology? Neisseria meningitis, Pseudomonas aeruginosa, Streptococcus pneumonia or E. coli. You can guess at least. If you do, it's still a mistake. Okay, the answer is A. Yeah, A is the right answer. Neisseria meningitis is the right answer. It's a purpuric rash, and what I said, that all, it's fever and all that. Usually you have to know it's a gram-negative diplococci. Gram-negative diplococci causing any rash in the body, that is purpuric rash, will cause by Neisseria meningitis. So yeah, so you have to remember this. And next question we have, next we have X-ray spine of a patient with chronic back pain shows a characteristic appearance of codfish vertebrae. So what is the investigation of choice to diagnose the underlying condition? And the options are DEXA, serum calcium or ALP levels, bone scan or quantitative CP. Usually you have to know a diagnosis, otherwise you won't be able to tell. See, I will repeat, it's a X-ray of the patient with chronic back pain is there and which shows characteristic feature of codfish vertebrae. So codfish vertebrae is good for diagnosis of what? And then first I want to diagnose, then I will tell the options are DEXA, sodium, serum calcium, ALP, bone scan or quantitative. So anyone can tell codfish vertebrae in X-ray is a sign of what, or in which condition you see in orthopedics. Okay, yeah. Okay, I will want to tell it's a codfish vertebrae is basically in osteoporosis. Yeah, so in osteoporosis we all know we do DEXA scan. So it's right answer, DEXA scan is the right answer. Next we have a 69-year-old patient, osteoporosis. 69-year-old patient comes to you with hypertension, has silver wiring, papilledema and atiovenous nipping visible on the fundoscopy. So but no other changes. What would you grade this disease? Grade 1 retinopathy, grade 4, grade 3, grade 2. Basically I will tell you what is the grading of the retinopathy when you have a patient with hypertension with silver wiring, papilledema and atiovenous nipping. So yeah, if anyone can guess at least what is the grade is 1, 2, 3, 4. Grading for retinopathy. Grade 3, no. See, grade 3 is basically it's grade 2 plus retinal hemorrhage or exudates. So the answer here is not grade 3, it's the grade 4. Grade 4 is at a grade 3, what I told, it's a hemorrhage plus optic disc swelling and silver wiring. The silver wiring, if anyone has silver wiring, is grade 3. No. Copper wiring is grade 3. Silver wiring is grade 4. You must check once because there they have given it's grade 4. Grade 4 is silver wiring, whereas grade 3 is copper wire appearance. And grade 1 mild generalized retinal AV narrowing, arterial narrowing. Grade 2 is focal arterial narrowing with deflection of veins and the AV crossing, that is Selous sign. So yeah, you have to remember like this. First is mild general swelling, second is Selous sign, that is the deflection of the vein in the AV crossing. Third one is the bonnet sign, gun sign, or it's a copper wire appearance. And grade 4 is the silver wiring. And whatever I told, that is papilledema and AV nipping will be there. So next we have a 40-year-old man comes to you with recurrent episodes of oral ulcers, large areas of denuded skin and flaccid blisters. So what is the first line investigation for this condition? So I don't know to tell the diagnosis for this also. See, the options are direct immunofluorescence microscopy, indirect immunofluorescence microscopy, enzyme link ELISA, and tan smear from the foot of blister. Usually it's a 40-year-old, recurrent episodes of oral ulcer, large areas of denuded skin, flaccid blisters. What is your diagnosis? First tell me that. Okay, the diagnosis here is, anyone? It's a pemphigus. It's a pemphigus vulgaris is the diagnosis. And for pemphigus, if it's a pemphigus, you know what is the diagnosis of choice. That is investigation of choice is tan smear. That you know from the floor of the blister. So yeah, recurrent episodes of oral ulcer, large areas of denuded skin, and flaccid blisters will be present in pemphigus vulgaris. And you have to take the T-Jan smear. And direct immunofluorescence microscopy is the most accurate test. But here they are asked what is the first line investigation. So first line is T-Jan smear. And if you want the most accurate, it's direct immunofluorescence. Next we have a female patient is there, and she comes to you with vaginal discharge, and she was found to have strawberry cervix. Which of the following is drug of choice? For strawberry cervix, I know only one diagnosis is there. So yeah, what is the drug of choice? Metronidazole, fluconazole, tetracycline, and ceftriaxone. If you can tell the diagnosis, you can tell the answer also. Strawberry cervix and in which condition? In OBG you have read many times. Strawberry cervix is in which condition? Anyone? Okay, I'll tell the answer if you don't tell the diagnosis. The answer here is metronidazole is the right answer, and strawberry cervix is seen in, anyone? Okay, it's seen in trichomoniasis. Trichomoniasis is where in strawberry cervix, and the drug of choice for trichomoniasis is this metronidazole is the drug of choice. That is like a Trichomonas vaginalis is profuse, thin, slightly green in color and frothy. Yeah, trichomoniasis. And then next we have which of the following is the best. It's the last question. Yeah, which of the following is the best test for quantitative analysis of RNA sample? And our options are real-time PCR. Second is reverse transcriptase PCR. Third is PCR restriction fragment length polymorphism, or RT-PCR followed by a real-time PCR. So yeah, okay, I'll tell this question again. Which of the following is the best test for quantitative analysis of the RNA sample? It's real-time PCR, reverse transcriptase PCR, PCR restriction fragment length polymorphism, or RT-PCR followed by real-time PCR. RNA sample, you know, if you know, if you don't know, it's okay. Yeah. In COVID, you might be knowing it's RNA only. COVID is also RNA. So yeah, it's okay. I'll tell it's the answer is last one is the right answer. That is RT-PCR followed by real-time PCR. So it is the best method for quantitative analysis for an RNA sample. So yeah, it's RT-PCR, which involves the generation of the complementary DNA, which you all know, reverse transcriptase and all that. So yeah, real-time PCR alone can only be used for quantitative of DNA only. And yeah. Okay, the best answer for this is D only. Yeah, D is the right answer. That is RT-PCR followed by real-time PCR. It's the best test for quantitative analysis for RNA sample. So yeah, we completed our MCQs for today. So yeah, meet you at 11. Thank you so much.